Hi, I'm Dr. Neha Raukar, a consultant at the Mayo Clinic, Department of Emergency Medicine, and I'm here to talk with you about ear infections. Ear infections occur in the middle ear, the air-filled space behind the eardrum that contains tiny vibrating bones of the ear. Anyone can develop an ear infection, but they are much more common in children than adults. The onset of signs and symptoms usually comes on quickly. For children and adults, these can include ear pain, especially when lying down, ear fluid drainage, and trouble hearing or responding to sounds. Children may also physically pull at an ear, have trouble sleeping, cry more than usual, have a fever of 100 degrees Fahrenheit or higher, and experience headaches, a loss of balance, and loss of appetite. Ear infections are caused by bacteria or a virus in the middle ear. They often result from another illness like a cold, the flu, or an allergy that causes congestion and swelling. Some people are more susceptible to ear infections than others. This includes children between 6 months and 2 years old, children born with a cleft palate, people with seasonal allergies, and those often exposed to tobacco smoke or air pollution. Your doctor or provider can diagnose an ear infection based on symptoms and an exam. They will likely use a lighted instrument or an otoscope to look at the ears, throat, and nasal passages. They also may use a stethoscope to listen to you or your child breathe. Your doctor or provider may perform other tests if there is any doubt about the diagnosis, if the condition hasn't responded to previous treatments, or if there are other long-term problems. If your child has had multiple ear infections, you may be referred to a hearing specialist, speech therapist, or developmental therapist for additional tests. Symptoms of ear infections usually improve within the first couple of days, and most infections clear up on their own within 1 to 2 weeks, without any treatment. The American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Emergency Physicians recommend a wait-and-see approach with ear infections. Because most infections are due to a virus, treatment may begin by managing pain with acetaminophen, ibuprofen, or anesthetic drops. If symptoms are not improving, this could imply a bacterial infection, and your doctor or provider may recommend antibiotics to clear the infection. Children younger than 6 months are more likely to be treated with antibiotics without the initial observational waiting time. If your child has certain conditions, the doctor may recommend ear tubes to drain fluid from the middle ear. It is important to get an accurate and prompt diagnosis for an ear infection. Call your doctor or provider if symptoms last for more than a day, ear pain is severe, your affected child is less than 6 months old, your infant or toddler is sleepless or irritable after a cold or other upper respiratory infection, or you observe a discharge, pus, or bloody fluid from the ear. Learn more about ear infections by visiting mayoclinic.org. We wish you well.